We are less than 24 hours now from 15,000 Minnesota nurses that could be walking off the job for the biggest nurses strike in U.S. history. Following negotiations going into the weekend, we've not received any reports of a deal, and if they can't reach a contract agreement today, nurses will begin the strike at 7 a.m. tomorrow. That's Monday. This impacts 16 hospitals across 7 healthcare systems throughout the Twin Cities and Duluth, as well as Moose Lake and Superior, Wisconsin. Joining us now to talk about some of those preparations underway this weekend is Jill Ostrem, the president of Allina Health's Mercy and United Hospitals. Jill, thank you so much for joining us. We appreciate it.
Good morning, Leah.
We want to make it very clear before we dive into our conversation here that you're not part of the negotiation team. You're not in those contract agreement discussions. You've been working on the logistics of, okay, if this strike doesn't indeed happen, what happens behind the scenes? But can you tell us anything as far as, we know there was some discussion on Friday, but are contract negotiations continuing through the weekend?
We don't have anything scheduled to bargain today.
Okay, so therein lies the assumption maybe that we probably are going to see the strike happen at 7 a.m. tomorrow. So then tell us about what you've been doing. How do you prepare for all these nurses leaving to go on strike?
Well, we've been working on contingency planning for a number of months. We never want to see a strike happen. That doesn't help resolve anything, but we do want to be prepared to make sure that our patients get safe and reliable care and that we're here for our communities throughout the duration of the work stoppage.
And how far and wide do you search for nurses that can come in and help, with this kind of passing of the baton, so to speak, when, you've got patients and new people coming into the hospitals and things like that? How far do you search to find nurses that will cross the picket line?
We work with our staffing agency, and they source nurses from all over the country with experience, talent, and skill. They're reviewed, vetted, and they all come through and have a Minnesota license. So they're prepared to step in and provide care for our patients, very committed.
And is there any sort of, I guess I was calling it the passing of the baton, for lack of a better phrase for it, but is there any sort of transition there? If this strike happens at 7 a.m. sharp, how does that work? If you're a patient, imagining being someone or having a loved one who's in the hospital bed and has been talking with one nurse for days or hours, and then the next minute a new nurse walks in?
So we do that transition every day from shift to shift, and so the nurses that are nurses, and we love our nurses, will leave on Monday morning, and the replacement nurses will be on site for the duration of the strike.
Can you speak at all to what it costs to bring in nurses from other areas? I know we've reported, various job postings all over the country, $80 an hour, make 12 grand in a few days. Can you speak to any of that?
It'll take some time to assess the cost of the work stoppage. It's never our preference to have this happen, but we're prepared to do it, and our priority is just to make sure that our patients are getting what they need and that we have the flexibility to care for needs throughout the week.
And the bottom line is keeping those hospital doors open and keeping it going.
Absolutely.
All right, Jill, thank you for your time. We appreciate it very much. Good
Thank you,
luck
Leah.
this week, and we'll watch and wait and see what happens.